For our last Overcoming Pain segment of the year, we take a look back at some of the topics that Dr. John Bergiolis discussed with us in 2015.
Dr. John Bergiolis is with us today. He is with Spine Pain Diagnostics Associates. Tell me what the specialty at your facility is. What do you guys do?
Sure. So we're essentially a practice that's been established for at least 25 years, and we're a clinic that's completely dedicated to the evaluation, diagnosis, and treatment of many different types of pain disorders. So spinal cord stimulation is one of the more advanced techniques that we have as pain physicians, and it's usually utilized for more debilitating diseases, which can be in the lower extremities, upper extremities, in the chest wall, and even the low back. So these leads that are implanted into the patient's epidural space actually generate a current, which helps dilute the pain signals coming to the patient's spinal cord. So symptoms of whiplash can include a stiff neck, certainly a painful neck, difficulty rotating the neck either with forward flexion, extension, or rotation, and it can even result in headaches and migraines in certain patient populations, and sometimes it can even feel like it spreads into the mid-thoracic cage and into the shoulders and even into the fingers sometimes. Osteoporosis can often creep up on the elderly, and it usually results in a weakening of the bone structure. This can result in fractures essentially everywhere in the body, but most often at our clinic we see it in the spine. So failed back surgery syndrome is a condition where a patient continues to have either low back and leg pain after a back surgery, which could include a laminectomy, a discectomy, or a fusion. Those are just some of the examples. That doesn't necessarily mean it's a failure, because sometimes these surgeries are indicated for one issue, such as a disc herniation, and if a patient continues to have pain afterwards, then their pain may be from a different source, such as severe arthritis in the low back. I have chronic scoliosis. What are some tips and methods you found to be useful with your patients to help cope with some of the pain? So the approach to scoliosis is a multimodal one, and so it can essentially involve many different treatments, including physical therapy, aquatherapy, and really at this clinic we like to perform injections, and so there are different types of interventional approaches which can also help with scoliosis. We see patients who have pain either where it feels like it's in the buttocks or in the hips or down the legs even, and that can actually be caused from the spine, and that's called referred pain. So even arthritis in the middle part of the spine can cause pain that actually feels like it radiates out into those different areas of the body. So we go around to different facilities and nursing homes really for the sole purpose of educating the elderly in the areas of different types of painful conditions. A lot of them don't know exactly what they have, so I try to go over the symptoms of the most common types of pain complaints with the patients so that they know exactly what they may be suffering from. This is Dr. John Bergiolis with Overcoming Pain.
And you can watch all of the Overcoming Pain segments from 2015 on our website at upmatters.com.